62-year-old man presents to office for a regular health checkup. He was diagnosed with type 2 diabetes 6 years ago, for which he takes only metformin. Over the past year, his daily blood glucose measurements have gradually been increasing. During his previous visit, his HbA1c levels was 7.9%, and the doctor discussed the possibility of requiring an additional medication to keep his blood sugar under better control. Today, his HbA1c is 9%. The doctor mentions a research article that has been published about a randomized controlled clinical trial of 200 subjects studying a new anti-diabetic medication. It has been also shown to significantly reduce glucose and HbA1c levels compared with the current gold standard treatment. However, possible adverse effects are still being studied, though the authors believe that they will be minimal. In this study, what would most likely increase the chances of detecting a significant adverse effect? So I want everyone to think that how would we get that this particular new drug is going to have adverse effect? Does decreasing the post-marketing surveillance time, would it decrease or increase? I guess it would decrease the adverse effects. It will provide less time. How about increasing the sample size? Maybe that can be an option. Non-randomization, I don't think so. Decreasing the sample size, if you are taking less patient, there is a less chance of finding out adverse effect. Increasing the selecting bias, increasing bias means you will get less effects. Okay, so I want every one of you to think it is just that you have to read the last sentence, and that is what you have to mark the answer from the last statement itself. The first three lines, they're just background to it. Possible adverse effects are still being studied, though the authors believe that they will be minimal. In this study, what would most likely increase the chance of detecting a significant adverse effect? How we will decrease the chance of detecting a significant adverse effect? So here we'll increase the sample size. The most likely answer is increasing the sample size. In this case, the patient's physician is discussing a randomized controlled clinical trial being conducted to compare the effectiveness of a new anti-diabetic medication with metformin, the gold standard treatment for type 2 diabetes. Randomized controlled trials are an important means of testing the effectiveness of novel medical interventions by comparing them with a control cohort or with the current gold standard treatment. Patients who meet the eligibility requirements are randomly allocated to a particular intervention group. The participants are blinded to the treatment they have been assigned, and ideally both the participating clinicians and the patients are blinded until the study is completed. All participating groups follow the same protocol and are evaluated in the same manner, whether they receive the intervention or not. Study data are analyzed by comparing the size of the differences for predetermined outcomes between the intervention groups. In randomized controlled trial, one of the best means of increasing the chance of detecting a significant difference is by increasing the study's statistical power. The power of the study refers to the probability of detecting significant differences in predetermined outcomes by rejecting the null hypothesis. Increasing the sample size will proportionally increase the power of study. The study currently has a sample size of 200. Increasing the sample size should increase the chance of detecting whether the investigation medication significantly reduces the blood sugar levels as well as detecting any potential adverse effect. So the learning objective for ourselves is randomized controlled trials are important tools for determining the effectiveness of novel medications as compared with a control or a current gold standard treatment. Increasing the sample size increases the power of the study to detect the significant therapeutic effects and the adverse effects.
Thanks for watching. Please give a thumbs up and subscribe for more.